Hi, today, unlike my previous videos, I'm not going to be talking about subjects, but more of an update. Um, so, I've been on Paxil for about 2 months. I went up to 40 milligrams. After that, I found the side effects basically intolerable and moved back down to 20 milligrams, which had been good for a while. The first couple of weeks on Paxil, I still shook. I still had tremors during bus rides, and I still needed my noise canceling headphones and my ebook. Um, so when I went back down to 20 milligrams of Paxil, things started getting better, but the side effects followed me from going down from 40 to 20. I was basically drowsy all the time. Um, Ever since a week, so the week after starting Paxil, so that's basically almost 2 months, I didn't go down to the electronics lab. I just spent hours and hours just researching the drug over and over again, mulling it over in my mind, ruminating about it. So when I become obsessed with something, they almost turn into interests, but they're very temporary interests. So I realized that the costs outweigh the benefits because I haven't been doing anything besides researching this stupid drug and trying to weigh the pros and cons of should I stay on this or should I not stay on this. So in addition to the drowsiness it caused, which made me take basically mandatory naps in the day, at least 3 to 4 hours. It was, lethargic. I just didn't want to move. I was lying down, reading all the time. Um, so in addition to that, I also had some weight gain, which is really unusual for me, and it's kind of alarming. My appetite has always been really, really finicky. Food for me is more of a duty rather than a pleasurable experience. Um, food is often downgraded to a secondary requirement. So if I'm working on an electronics project, my appetite is completely gone. Electronics takes over that position much more strongly than appetite. So often I have to remind myself to eat. So usually I skip breakfast and lunch, and I just have a big dinner. Um, but also at the time of dinner, if I'm doing something, I actually forget if I ate. So sometimes if I forgot that I ate something, I'll be doing something. I said, oh, I have to eat again. It's like a requirement. Like, oh, did I eat? Or. So so food has always kind of held that position for me. I do enjoy it. Like I enjoy going out to restaurants much more than eating in. Um, but on the Paxil, I noticed some weight gain, and the way I noticed this was, I mean, I didn't weigh myself on a scale or anything, but I would wake up in the morning and want to eat, and that was very foreign to me. Normally, I wake up in the morning, I'm slightly nauseous. The last thing I do is want food in my mouth. It's just how I've always been. But I wanted food, like immediately when I wake up, I said, I'm gonna go down into the kitchen, I'm gonna make myself macaroni cheese or this and this. I would crave food all of a sudden. And that was very strange for me, and I didn't like it. I guess that's how normal people feel. Normal, they say that I can't go without breakfast, I can't go without lunch, but for me that's always been a secondary priority, so to speak. So I don't, it was kind of alarming on the Paxil. So generally, this drug just made me so lazy and just want to eat. Like it's just like it's a couch potato making drug. I was happy, I wasn't having, I wasn't I was much less anxious, but meanwhile, I was just sitting on my ass, right? I'm not doing anything. So, not a fan of Paxil. So, I wanted something similar because I was on Lexapro for about 5 years, or 5 or 6 years, and that seemed to be helping for a while. But I guess within the past year, that kind of started losing its effectiveness, and I also wanted to test how my life would feel like without SSRIs. Just, I always like getting kind of a medication versus non-medication standpoint of what's my true character? Is the medication actually changing me? Is it changing my core personality? The answer was, after I got off the Lexapro for a time, the answer is it wasn't changing much. It was changing my, I guess, basal level of anxiety. I guess that does change my character. I'd be a lot more nervous when going out in restaurants, shaking my leg or, there's a general sense of agitation. But my interests never changed. My core personality traits never really changed on or off the drug. It was just this degree of whether the anxiety was there or not. Um, so that's why I wanted to test life off Lexapro, life off SSRIs, um, and like I said, it's much better on them. Like I'll give it that. I didn't want to be anxious anymore. It's just after I got off of it, I realized the whole reason of going on it in the first place. So that's when I heard about Paxil for social anxiety specifically. But like I said, it was a dirtier drug than Lexapro. I think it was more effective for the anxiety, but the side effects just became intolerable and kind of unexcusable. Sure, I was happy, but I wasn't doing anything. So I decided to go on another harsh drug. The withdrawal of Paxil is not pleasant. And I decided to go on, instead of an SSRI, go on the SNRI Effexor, which apparently is notorious for having the worst withdrawal of probably any antidepressant. But I've heard of a method to withdraw from Effexor whenever that time comes. If the drug is not effective for me, hopefully I'll realize this sooner. At a point in time that if I stop the Effexor, I wouldn't experience withdrawal since I was on it for a short period of time. But even if I am on this drug, let's say for a couple of years, right? I already have, I've already researched methods for reducing the withdrawal. You could slowly taper off of it. You can't go cold turkey on this thing. You could slowly taper off of it. And I mean by taper, I mean you have these capsules. The Effexor comes in capsules. When you open them up, you see little small beads of the time-released chemical. So apparently the best way to get off Effexor is, I think the average capsule has probably about 80 beads of Effexor venlafaxine chemical in it. So apparently the easiest thing to do is open up. It's time consuming, but it's the best thing. And so what you do is you open up the capsule, you count out the beads, and you have a regime where each day you take one less bead per capsule. So you're just taking, if you have 80 capsules, you're starting with 80 and go to 79, 78, 70, so on and so forth. I mean, it'll take, a couple of months, but apparently that's the easiest way to withdraw from it. So I'm not going to go cold turkey on this. I have alternatives. I have ways to get off of this drug when that time comes, and I feel like the benefits, if it works, will outweigh the costs of withdrawal if you do it smartly enough. If you're careful enough with it. So immediately I went from 20 milligrams of Paxil to 75 milligrams of Effexor. And this was an attempt to avoid the Paxil withdrawal. I hoped that if you're taking the medications, basically, you stop Paxil, or, I was even on 10 milligrams of Paxil when I first started the 75 milligrams of Effexor. So I was hoping that as Paxil's going down, Effexor is going to go up, and it's going to kind of block the withdrawal of the Paxil. And it has to some extent. I was dizzy for about 2 or 3 days. I had really, really strange nightmares last night about, I don't even want to talk about it. It's ridiculous nightmares. And I knew from previous experience that was an effective SSRI withdrawal, because I experienced that on Lexapro, Cipralex, escitalopram. So So yeah, so I'm going to see how Effexor is working for me. Another reason why I went on Effexor is because apparently it is a little more agitating, it's a little more activating than the Paxil, and that's kind of why I wanted to go off Paxil in the first place. So I hope this is, there's a little more pep to this drug and it's not going to make me drowsy. Apparently, it can. It could have that kind of paradoxical effect where some people can actually get just as drowsy on it as they were on Paxil. But I hope that doesn't happen, and it hasn't happened so far. I notice my thoughts are more fluid. You probably notice that I'm speaking faster. I think I have a better presence in front of the camera. I'm more confident. There's not as many blinks. Like the first couple of my videos are just like half of them are like there are all these pauses in the videos, and well, it could be that I was nervous for making the first videos, but I seem a lot more confident on the Effexor. I'm able to act a lot better and not be anxious about keeping up appearances. So it kind of enhances my acting skills to some extent. But that's good. That's what I want it for anyway, because that reduces the anxiety. So yeah, so there's just an update on what's going on medication-wise. I don't know if this is of interest to anybody, but hopefully I made a couple of good points about certain side effects you can get with SSRIs and how to possibly do a switch without withdrawal side effects. So, yeah. Thanks for watching.